on it was aired with just a piece of skin at the back of the hand. So we had to quickly revascularize the hand so that it will not, it won't die.
One of the reasons why I find this very remarkable is that I read about an incident some time ago where somebody who worked in a factory had his arm severed by a rotating blade. You know, it was rotating so fast he couldn't see the blade, and then he got there and suddenly the arms were off. But he said that these limbs were packed in ice. While he was rushed to the hospital, they were reattached. Of course, this was abroad and it was in the 70s, and he got to use those arms again. So I'm wondering, was this packed in ice, and have things changed? You don't pack in ice anymore? Can you explain that?
Well, if it is complete amputation, what is advised is that you wrap the amputated parts in a sterile gauze. Then you put it in a cellophane bag before you drop it in the ice pack.
Okay,
then
like an exhibit at a crime scene or something like that.
You quickly move the patient and the amputated part to the center where they have a microsurgeon, not just any type of surgeon. You need to get a microsurgeon to be able to attach that amputated part. And it has to be within 6 hours of the injury if it is totally severe.
Okay.
But
so in his case, because he had some skin there.
Yes, it still has some what we call collateral supply to the thumb.
Okay, but how does skin supply the hand?
No, there are vessels, through the skin that we still give the thumb some blood to survive until it goes to our center.
So within 6 hours,
the time
if
it
is
got to me
completely
was
severed.
too long.
Okay.
So if it is completely severe, it has to be within 6 hours of the injury.
Okay.
Otherwise, whatever you do after that will not work.
So after this procedure, how did it feel? Were you in a lot of pain and all that?
No, not really. In fact, after the surgery, by the time I woke up the next morning, I was ready to go home.
Are you
I told Doc, I told him, I said, Doc, can you just discharge me, let me go back home? He looked at me and said, do you know what we just did to your hand? We spent 7 hours reconstructing your hand. In fact, you are not going home, you are staying here for 2 weeks.
Doctor, what happens if some skin or flesh or maybe ligament gets missing in the course of, someone having an accident with his limbs? Can you manufacture something to replace it, or what do you do?
It's one of the basic principles of reconstruction, that you have to replace like with like. I said during my introduction.
Okay, just like you did the vein.
Yes,
to
you
replace
can
the artery.
harvest tendon now from any part of the body to replace any missing part.
But what happens to the place you harvested it from?
No, that's
because you're cutting something, right?
That's why we call it graft. You are robbing Peter to pay Peter. We are not. we are using it for the same patient. We are not transferring it to another. There's what we call donor side mobility. We'll make sure there won't be problem where we are harvesting it. Really, there wouldn't be problem.
Okay. I want to ask you, because I'm really curious. Show us this hand. Can you move it? No, by move, I mean use it.
Yeah.
Because I can see where the sky is.
I can write.
You can write?
Yeah, I can write.
How soon after?
How soon after? Took me about 2 weeks.
Okay.
But what I continued to do and what doctor advised me was that I should continue to move the hand. Even when it was in the bandage, I continued to move the hand, and he advised that, he instructed that I should keep the hand up so that blood does not stay inside that location and it drains and it moves. So I kept it up. I was quite obedient, quite attentive, so I kept it up because I know I have to save that hand and make sure that it works. So, and at the same time, I was trying as much as possible to exercise the thumb so that I can move it, and I think that has helped me a lot.
How much of the use of that hand would you say you've got? Like, you remember how it was before this incident. How is it now in comparison?
I would say in comparison, I'm able to use this term to about 70%.
Okay, let's ask the doctor. You know, they usually mention these things. They usually measure them in percentages. Do you think it will ever get to 100%, and what is it
Yes,
at now?
with good physiotherapy, you should be able to recover 100%.
When you say physiotherapy, do you have maybe a band of specialists you work with every time you do this kind of
It's
thing?
a teamwork.
Okay.
It's a teamwork. No doctor can do it alone. In Lasut, we have good physiotherapists that, you know, we work on it and it will be back to 100% function.
Okay. Does he have to use medication continuously because of it?
No.
You know,
just for the time of admission. After the wound has healed, he doesn't need any medication again. All he needs is to just continue to move the thumb.
When you have to join such small pieces together and tiny vessels together with a foreign body like a needle, don't you need a heavy cover of antibiotics?
Yeah, we did that pre-op and intra-op, then post-op. It has to be on antibiotics for at least a week before we stop it.
And how long post-op?
Post-op, I think, for 5 days before we stop the antibiotics.
Okay, so does he still need to work on that hand to keep it functional?
Yes, that's what I said. He has to continue physiotherapy until he gains 100% function of the thumb.
Can you perform this kind of surgery on any other part of the body?
Yes, provided we get the amputated part within 6 hours. And also, microsurgery is not just to reattach amputated parts. It can be applied from head to toe. What I mean is that head and neck, after resection of a tumor, plastic surgeon will be called in to come and replace whatever has been taken away. Like if the jawbone is removed, we can bring the fibula to reconstruct the jawbone.
We will have to do more of that after the break, because this is sounding fantastic. Okay. Let's take a short break. We're going on a short break now. We'll be back shortly.